Today our topic of discussion, drugs used for erectile dysfunction. Drugs used for erectile dysfunction. It is come as a short note. It is used for some MCQ purpose and as a part of long question. First, what are the drugs used for erectile dysfunction? We can differentiate it in two types, centrally acting and peripherally acting. Centrally acting are androgen for desire and apomorphine for the arousal. These are acting centrally in CNS, whereas drugs treating in erectile dysfunction which are acts peripherally, they either can be given orally, can given locally as a spray, as intraurethral or transcavernosal. But most common drugs used for erectile dysfunction is phosphodiesterase 5 inhibitor. Phosphodiesterase 5 inhibitor. Can you name some other drugs which are phosphodiesterase inhibitor, not specifically 5? Phosphodiesterase inhibitors used in which clinical situations? Theophylline, where it is used? Asthma. They inhibit which type of phosphodiesterase? It is primarily non-specific. For pharmacological action, 3 and 4 is important. For 5, it is used in case of erectile dysfunction. Sildenafil. The brand name is Sildenafil. They inhibit phosphodiesterase 5 inhibitor. And another thing which is come regularly as a MCQ, that what is the most common side effect of sildenafil or phosphodiesterase 5 inhibitors are color changes, yellow to blue discolorations. And why it is happen? Because inhibition of phosphodiesterase 6 inhibition. So phosphodiesterase 5 inhibitors are used for erectile dysfunction. Non-specific phosphodiesterase 3 primarily used for bronchial asthma, and the side effect of phosphodiesterase 5 inhibitor most common is, one of the most important is color disturbance, and it is due to phosphodiesterase 6 inhibition. So phosphodiesterase you have to specify which is used in 3 and 4. 3 and 4 more commonly in case of bronchial asthma, whereas 5 in case of erectile dysfunction, and their side effect or discoloration side effect, eye side effect due to phosphodiesterase 6 inhibition. And nitrates also helpful. So what are the commonly come as a short note, drugs used for erectile dysfunction? We can differentiate it in two portion, one acting centrally, one acting peripherally. Centrally acting, androgen for desire and apomorphine for the arousal, whereas peripherally it can be act like nitrates. Nitrates, how it acts primarily, where it is used? Nitrates, angina. How it acts? They increase cGMP. By increasing cGMP, anoryl guanine cyclase, then there is a dilatation of which type of vessels? Vein or artery? Primarily veins. Clear? Similarly, nitrate, any vasodilators, this type of vasodilator is also effective in case of erectile dysfunction. But most important, the drug is phosphodiesterase 5 inhibitor like sildenafil, valinafil. Then some oral drugs can be used like testosterone, apomorphine, oral phentolamine, iohambine. Iohambine is how it is acts? Iohambine পড়ানো হয়েছে। আলফা 1 ব্লকারের নাম কি? আলফা 2 আলফা 2 ব্লকার phentolamine. It is iohambine. Then some locally acting drugs like alprostadil, they can given in transurethral, intracavernosal injection, it is injection, local injection, and topical. Some topical like minoxidil, nitroglycerin, where minoxidil used? Minoxidil arteriolar dilator. That is also a vasodilator. How it acts? Potassium and nicorandil, potassium channel opener. Minoxidil primarily used in alopecia, hair loss. So these are the drugs used for erectile dysfunction. So what is erectile dysfunction? First, it is inability to sustain a erection of penis for sexual performance. And they have 4 components. There is a psychological component, there is a neurological component, hormonal component, as well as vascular component. Then erection of following the genital stimulation, that can be auditory or as well as visual. So how it acts? The blood flow in the corpus cavernosus, if it is engorged, then they block the veins. So that increase the vessels and tense the penis. So that is why any vasodilators that increases blood flow in the corpus cavernosus and for a duration by blocking the veins and arteries surrounding it, that is peripheral arteries, circumferential veins, they can helpful for erectile dysfunction. So how it is important? Why it is happen erectile dysfunction? They can happen due to some precocious disease like diabetes, if there is a hypertension, if there is a dyslipidemia, if there is smoking, that leads to এগুলো কি করে? Atherosclerosis. If there is a atherosclerosis, there is a less amount of blood flow into the corpus cavernosus, that lead to erectile dysfunction. Similarly, endothelial cell injuries is due to atherosclerosis, vasoconstriction, even thrombosis can lead to erectile dysfunction. So what are the drugs that can cause erectile dysfunction? Firstly, antipsychotic as well as antidepressant, centrally acting drugs. Then some centrally acting antihypertensive. Centrally acting antihypertensives like methyl dopa, clonidine. How clonidine acts? Clonidine alpha koto. Centrally acting agonist, alpha agonist. Similarly, methyl dopa, where it is used commonly? Methyl dopa, hypertension in pregnancy or pregnancy induced hypertension, we prefer methyl dopa. Nowadays, drug of choice of pregnancy induced hypertension or hypertension in pregnancy? Labetalol, very good. And this drug belongs to which group? Alpha plus beta? Blocker or agonist? Sure, blocker. So these drugs, antidepressant, antipsychotic, as well as centrally acting antihypertensives like methyl dopa, like reserpine, like clonidine, they can cause erectile dysfunction. It is not used for erectile dysfunction. Name some drugs. But for MCQs, sometimes they give some drugs which are effective in erectile dysfunction and some drug that can cause erectile dysfunction. These drugs, so if there is a antipsychotic or antidepressant, first you go for that. If that any antipsychotic or antidepressant can cause erectile dysfunction. Similarly, centrally acting antihypertensives like methyl dopa, like reserpine, like clonidine, they can also cause erectile dysfunction. Some beta blockers and thiazide diuretics, that can also cause erectile dysfunction. Anti-androgen drug reduce the desire like finasteride, cimetidine, estrogen containing medicines, and cyproten acetate. These can also cause peripherally acting drugs that can cause erectile dysfunction. Cigarette, alcohol in big amount, and chronic alcoholism leads to hypogonadism that can also cause erectile dysfunction. So, drugs which are cause erectile dysfunction is antipsychotic, antidepressant, then antihypertensive drugs, both centrally acting and some beta blockers as well as thiazide. These drugs can cause erectile dysfunction. Then anti-androgen drug, cimetidine. Cimetidine is used for it is antihistaminic. H2 blocker is not antihistaminic. Though H2 is a histamine receptor, but you can't say it is a antihistaminic. Antihistaminics are H1. Name some. And they have classes, first class, second class, depending on the sedative agents. And finasteride, cyprian acetate, and some smoking, large amount alcohol, chronic alcoholism, that can also lead to erectile dysfunction. So, centrally acting androgen, increased desire, how it can help in erectile dysfunction. Apomorphine, increased arousal. Nitrate, prostaglandin analogs, papaverine and sildenafil, they all act to the similar action. They increase cGMP, in release NO. If there is a release of NO, what happen? Vasodilation lead to, kothakar vasodilation is important, corpus cavernosus, capillary. They block the venous drainage of the penis, that affects or reduce the erectile dysfunction. Phosphodiesterase 5 inhibitor, cGMP, vasodilation. What are the, it is the first line therapy. What are the other use? What are the other use of sildenafil? What are the other use other than erectile dysfunction is pulmonary hypertension, and if there is a association of BHP as well as premature ejaculation. So, another important thing after erectile dysfunction is pulmonary hypertension. It can also used in pulmonary hypertension. Next, where it is the should not be used, it should not be used if their patient have a ischemic heart disease. If the patient is already an anti-hypertensive like alpha blockers, if patient has a bleeding or epistaxis. Major ADR is ischemic optic neuropathy, sudden loss of vision. It is primarily due to phosphodiesterase inhibitor, which type? 6. 5 for its pharmacological action, 6 for their side effects. Photoreceptors, you see PDE5 phosphodiesterase, that is alteration of the vision. It is one of the important side effects. For absorption, if it is come as a short note, for any drug you have to introduction, then there is a pharmacokinetic. In pharmacokinetic, what are the point you have to write down? ADME, absorption, distribution, metabolism and excretion. So, for absorption, food, especially fatty food, interferes with the absorption. Metabolism, it is important, CYP3A4. So, through the CYP3A4, so any inhibitor can increase its concentration, whereas any inducer, CYP3A4 inducer, can reduce its therapeutic values. Dose when to take 1 hour before the sexual act. For sildenafil, it is maybe for 1 to 12 hours, but most of the other more than it is 1 hour before the action. What are the contraindication? Alpha blockers, it can causes orthostatic hypotension. Orthostatic hypotension. So any alpha blocker or any vasodilator should not, if patient is taking any nitrates for his ischemic heart disease, you should not give these drugs. There may be some sudden cardiac arrest due to the vasovagal as well as due to the hypotension. Quinidine, procainamide, amiodarone, it should not be given along with sildenafil for similar effect. So other drugs like alprostadil, it is a prostaglandin E1. It can be given transurethral or as an injection, local injection. That can lead to pain, bleeding and urinary tract infections. Topicals one can be given minoxidil, nitroglycerin or papaverine. These drugs can be given as a topical spray, like a topical spray. Last one is priapism. Priapism, what is priapism? The persistent painful erection. Persistent painful erection where we can aspirate the, we can aspirate the blood if there, or we can give phenylephrine intracavernosus injection, phenylephrine injection to prevent this priapism. So persistent, so this drug has a side effect. Longer, if it is longer acting, they can cause priapism. And this drug, where if there is priapism, we can give phenylephrine for its treatment. Clear up to this? So what are the, first is what are the drugs used in erectile dysfunction? What are the drugs used in erectile dysfunction? First key, centrally acting, peripherally acting. For long question. For Viva, first drug is phosphodiesterase 5 inhibitor. For theory purpose, centrally acting and peripherally acting. তাই তো centrally acting কি আর for peripherally most important phosphodiesterase 5 inhibitor, then some oral drugs, nitroglycerin can be used and some local drugs can be given. Alprostadil can be given transurethral or transcavernosus. Clear? এটা কি এন্ডোক্রিন শেষ আজকে, আর কিছু বাকি আছে এন্ডোক্রিনে? হ্যাঁ, কর্টিকোস্টেরয়েডের একটা ক্লাস বাকি আছে এখনো। আর ওরাল হাইপোগ্লাইসেমিক, ইনসুলিন হয়ে গেছে, ওগুলো সব কি পরীক্ষায় ছিল? আচ্ছা, ইনসুলিন অ্যানালগস এর কিছু নাম বলো না, এরকম ভাবে বললে কিন্তু ওই 50% কোনো রকমের। ফার্স্ট কি করতে হবে? আল্ট্রা শর্ট, শর্ট অ্যাক্টিং, ইন্টারমিডিয়েট অ্যাক্টিং অ্যান্ড লং অ্যাক্টিং। এবার একটা একটা করে অন্তত নাম বল। What are the drugs used for? Oral drugs can be used for type 2 diabetes. So there are two types. One is who increase insulin secretion, secretagogue, and which reduce the receptor or increase the receptor sensitivity. Receptor sensitivity কে কে বাড়ায়? হ্যাঁ, মেটফরমিন। আর ইনসুলিন সিক্রেটাগগ কে কে আছে? ফার্স্ট এই DPP4, সালফোনিউরিয়া। ফার্স্ট হচ্ছে সালফোনিউরিয়া। সালফোনিউরিয়া, হাউ সালফোনিউরিয়া অ্যাক্টস? সোডিয়াম পটাশিয়াম, পটাশিয়াম কি করে? ব্লক করে না ওপেন করে? ব্লক করে। পটাশিয়াম ওপেন করে একটা ড্রাগের নাম বলো? নিকোড্যান্ডিল। ওপেন করে, ব্লক করে কে? সালফোনিউরিয়া। So if a question came, name a drug that blocks the acts on potassium channel, সেখানে নিকোড্যান্ডিলও হবে, মিনক্সিডিলও হবে, সালফোনিউরিয়া হবে। কিন্তু যদি বলে ব্লক করে তাহলে কিন্তু মনে রাখতে হবে কোনটা? সালফোনিউরিয়া। ওপেন করে কে? নিকোড্যান্ডিল। ভেরি গুড। নাও you tell me, is there any role of insulin? Is there any role of insulin in type 2 diabetes mellitus? Is there any role? Question টা শোনো, is there any role of insulin in type 2 diabetes mellitus? পরীক্ষা হয়েছে তো এগুলো, বলো। হ্যাঁ, রেজিস্ট্যান্ট স্পেসিফিক লেখা আছে কিন্তু বইতে। হ্যাঁ, নাম্বার 1, if there is a OHS, কিটোঅ্যাসিডোসিস হয়। কাদের হয় কিটোঅ্যাসিডোসিস? প্রাইমারিলি টাইপ 1 আর টাইপ 2। টাইপ 1 এ কিটোঅ্যাসিডোসিস। আর হাইপার অসমোলার নন কিটোটিক কোমা কাদের হয়? টাইপ 2। কি ড্রাগ দেওয়া হয় তাতে? কি ড্রাগ দেওয়া হবে? fluid, insulin, potassium supplements if required. So insulin can be used in কোথায়? Type 2. Type 2 তে number 1 is if there is a hyperosmolar non-ketotic coma. Number 2, in pregnancy. Number 3, hospitalized patient with infection. Type 2 হলেও সেখানে ইনসুলিন দিতে হবে। টাইপ 1 এ কি ড্রাগ ইউজ হয়? Type 1 এ insulin. Any other drug can be given? দেওয়া যায় আর ড্রাগ? ভোগলিবোজ কোথায় ইউজ হয়? কিভাবে কাজ করে ভোগলিবোজ? They prevent absorption of glucose from the gut. তাই তো? তাহলে is there any role in type 1? Side effect of metformin? হ্যাঁ, lactic acid, megalobia, very good. আর সালফোনিউরিয়াস কমন সাইড এফেক্ট? hypoglycemia. Hypoglycemia is the most common. আর কি ছিল এতে? বিসফসফোনেট কিভাবে কাজ করে? বিসফসফোনেট কোথায় ইউজ হয়? অস্টিওপোরোসিসে। কিভাবে কাজ করে? Activity of osteoclast will be reduced. অ্যান্টিবায়োটিক স্টার্ট হয়েছে? নেক্সট উইক থেকে অ্যান্টিবায়োটিক। সিবিএস পুরো কমপ্লিট তো? পরীক্ষা কেমন গেছে? ভালো হয়েছে? হার্ট ফেলিওরের ড্রাগের নাম বলো। কোন ডায়াবেটিক্স? আর নাম্বার 1, নাম্বার 2? আর digoxin? Where it is used nowadays, digoxin? Chronic heart failure. আর drugs used in angina? First line drugs used in angina? হ্যাঁ, আর একটা হলো where beta blocker cannot be used? Variant. Why? Why it cannot be used? Vasospasm? Counteract করতে পারেন। How it acts? Beta blocker acts in angina how? they reduce the heart rate, they reduce the oxygen demand, but they cannot counteract the vasospasm caused in the variant angina. Nitrates, which vessels are dilated in nitrates? Venodilator. Or for heart, is there any effect on the circulation of heart? Redistribution. Redistribution means blood flow is more towards the ischemic area than the non-ischemic area. Very good. What are the common side effects of nitrate? Hypotension or headache. Nitrate headache কেন হবে? Vasodilation হবে, সেই জন্য headache হবে. Very good. আর ফার্স্ট লাইন অ্যান্টি-হাইপারটেনসিভ ড্রাগস? একজন বলো। Diuretics, among these diuretics, which one is important? First line antihypertensive. Which type of calcium channel blocker is first line drugs for hypertension? Dihydropyridine. Name? Amlodipine. Very good. Now tell me different types of diuretics. বলো, একজন বলো। কে বলবে বলো? না, ইউজ বলো, ইউজ একটা করে। একটা ইউজ বলো। হাই সিলিং ডায়াবেটিসে একটা ইউজ। হার্ট ফেলিওর। থায়াজাইডে? হাইপারটেনশন। পটাশিয়াম স্পেয়ারিং ডায়াবেটিক্স কোথায় ইউজ হয়? স্পাইরোল্যাকটোন কোথায় ইউজ হয়? জোরে বলো, জোরে। edema due to cirrhosis of liver. তারপরে তিনটে হলো, তারপরে বলো। আর তিনটে ক্লাস হয়েছে, আর আছে? থাইরয়েড, ওটা থাইরয়েডে গেল। তারপরে অসমোটিক ডায়াবেটিক্স আছে, কোথায় ইউজ হয়? গ্লুকোমা ইউজ হয়। আর কিছু আছে? নেম? কোথায় ইউজ হয়? আর মোশন সিকনেসে কি ড্রাগ ইউজ হয়? আর মর্নিং সিকনেসে? এন্ড doxylamine. Doxylamine is commonly used for morning sickness.